Is a vampire facial actually effective since the PRP is just rubbed on the top layer of the skin after use with a dermapen? Does it really get rid of wrinkles, scars, and does it really promote collagen and elastin on the skin since the PRP is not really injected?
Thank you for your question. You're asking if the vampire facial is really effective for inducing collagen, elastin, etc. If PRP is just being rubbed on the skin as opposed to being injected. So I think this is an excellent question, and I can certainly give you my perspective on this. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people rejuvenate their skin and deal with many issues has been a very important part of my practice. I'm a member of the Vampire Facelift Network of doctors, and I've been a media resource periodically when questions about these treatments arise. In particular, recent history, a well-known celebrity posted photos after a vampire facial, which led to a lot of questions about this treatment. So it all begins really with what is the intended problem that you want to treat, and the question is there benefit in creating openings in the skin with a microneedle versus injecting? Now, from my perspective and the types of patients who I treat, what we want to do is get the most benefit with the least amount of downtime. When we talk about doing the injection is done in a way so that we increase the fat under the skin in terms of its quality, because it is beneficial to fat to have PRP. It secondarily improves skin quality. We want to inject it within the dermis to help build collagen in the dermis, which is the foundation of the skin. Now, when you talk about fine lines and wrinkles, the microneedling procedure can be compared in some ways to fractional lasering. And what's being done with fractional lasering that's comparable to microneedling? Well, small, narrow channels are being created through the epidermis into the dermis to get a dual benefit. You're getting both the benefit of the stimulation of the dermis through the trauma, as well as some degree of re-epithelialization, which improves the overall skin quality on the epidermis. Now, microneedling in some ways, especially with an automated device like the dermapen you refer to, has to be done very, very carefully. You can set the depth like you can when you do the parameters of a fractional laser, and you should, as well as set the frequency. The important thing is to define what the desired outcome is. Now, the question you're asking is, if you're just rubbing the PRP on top, how much good are you doing? Well, I can tell you that application of PRP does improve the rate of healing. It does enter into those channels to stimulate this collagen production, and therefore it does have value in the context of this vampire facial treatment. In fact, when we do laser skin resurfacing, or if we use fractional laser, I routinely use PRP both as a way to facilitate healing by topical application, and depending on the scenario, I will also inject PRP into the skin. So I think that you can at least understand that the science is certainly valid of applying PRP. The question is it the right thing to do in your situation? A lot of times people come to me for the vampire facial, And when I explain to them what's involved and what's the downtime and that initial level of blood or redness that depending on the depth, they often opt for actually PRP injection or platelet-rich fiber matrix injection. So this is now, in the absence of a photo or in the absence of physical examination, for me, I would encourage you to now meet with doctors and learn about these options. Meet with someone who is part of the Vampire Facelift Network, who naturally will likely have a lot of experience with these treatments and be able to guide you appropriately. So I hope that was helpful. I wish you the best of luck, and thank you for your question.